So today it's my pleasure to introduce a very important person in our hospital, the pain specialist Dr. Meera, with whom we had a long association. Dr. Meera works behind the scenes in the operation theatre most of the time, but she's got extensive knowledge about pain and various aspects of pain and how to manage. So much so that whenever there is a patient with severe intractable pain, we request Dr. Meera to have a look. Welcome, Dr. Meera.
Thank you so much.
And today I would like you to tell the audience what exactly does the pain specialist treat. After all, everyone has got headache, everyone has got backache, they pop in some pills. What does the pain specialist do?
The pain medicine has come into existence, I should say, around somewhere between 1970s. From 1974 onwards, internationally it is a branch, it is a super specialty branch which has been acknowledged.
It is a
recognized specialty.
Wow.
Though there are fellowships and there are even MD, after post MD people are doing DMs now.
Fantastic.
In pain medicine.
Okay.
So this pain medicine now people are doing, and here we treat chronic pain. Chronic pain is some pain which is beyond a duration. It is basically defined as pain beyond a duration of 3 months.
Okay.
So pain already being treated, but the pain does not go away beyond 3 months, and it can be there in any part of the body. It can come and go, and it can stay continuously, or it can come and go. And it can start from any part of the body, like the neck pain, the headaches, the chronic migraine headaches are also being treated by chronic pain specialists these days. So neck pain, the lower back, cancer pains, for palliative care of cancer pains. Then you have knee arthritis, patients who can't go in for surgery. That is where we come in. Patients are done with the medication, the pharmacotherapy, and the surgeries are not, they're really not candidate for surgery.
Okay.
So the pain specialist, the interventional pain management comes into play there.
So you treat pains from the top of the body, top the head to right to the toes.
Yes.
But there are various types of pain. Sometimes we hear of acute pain, severe pain. Sometimes we hear of chronic pain. What exactly does it mean, acute pain and chronic pain?
Okay, acute pain is something, where the pain starts when you have a skin cut of a skin, or a broken bone. Injury is there, when there's a hurt. So that pain heals. When the skin heals, the pain goes away.
Right.
When the bone unites, the pain goes away. But chronic pain is something that sometimes there is no obvious cause. So this pain is an intractable pain which stays. So it is called, sometimes the nerves are involved there, the irritation or inflammation of the nerve, neuropathic pain. You have different kinds of pain in this, where chronic pain has no obvious cause many times. It can be psychogenic pain, or it can be psychosomatic pain, where, due to stress, patient has either anxiety, depression or stress leading to this kind of pain. So chronic pain has various modalities where we can plan the management accordingly.
So what I understand is that pain is again a sensation or emotion kept in our body by nature to protect us from injury, from a fire or a burning pot. But when there is an injury and then there is a cut, immediately you attend to it. But when there is no obvious cause and the pain is long lost after the disease is over, then there is a role for the pain specialist to intervene. Am I correct?
Yes.
Now,
absolutely.
Could you kindly tell us which is the various types of chronic pain that you treat?
We treat migraines. Migraines, when the medicine...
What is migraine?
Migraine is a kind of, there are different kinds of headache. Cluster headache. Migraine is when there is, the patient has an aura along with the headache, the sound aura or a visual aura. And the patient headache comes, stays for some period of time, and then the pain goes away.
Okay.
So with the medical management, sometimes it becomes so severe that patient is unable to bear the pain.
Right.
Then we have a role of injections. We give botulinum toxin injections there, which is around 3 to 6 months, patient is pain free.
So we are now talking of pains which are different from ordinary headaches. All of us do have headache at times, but they don't call for a big treatment. But where there is a periodic headache and which is interfering with your lifestyle.
You're not able to do your everyday work. Your social life is getting affected.
Then it is time to meet the doctor for treatment of this chronic headache, which is also called a vascular headache or a migraine. Migraine is a very, very important disease that you must be treating. Now, is there any other diseases where there's a chronic pain upsets the person?
We have all disc prolapse happening. The cervical disc prolapse.
Even the spine?
Yes, spine, on the spine. Facet arthropathy. We have the shoulder, arthritis.
Right.
And all the first or second degree, you have all the ligament tears. where you
Okay.
don't need surgery.
Okay.
But it is not healing with just medicines. So in between grade 1, grade 2, we have ACL repairs we do. We do PRP therapies there, platelet-rich
So
plasma
what
injections.
this means is ACL means knee joint
Knee
when
joint,
it deranged
yes.
inside the anterior cruciate
Yes,
ligament
ligament is
tear.
tear, all the
that
ligament
is
tear.
severe pain, long-standing pain,
Yes.
for which people go to treatment
Yes,
for operations
yes,
and
yes.
all. So these are the various types
So
of
what
pain.
I would like to tell you is we come somewhere between the medical, the physicians and the surgeons.
And the surgeons who are going to operate anyway.
Yes.
So the pain specialists are a cushion between the routine painkillers that we all use,
Yes.
but before short of surgery, something else can be done without
with
surgery. Maybe you can relieve the pain. Am I
Yes,
correct?
yes.
So, and what are the types of pain that you pain is such a common thing that we all have: ear pain, jaw pain, and
Exactly.
how do you classify which is one which is where to you to visit the doctor?
Depending on the cause of the pain.
Right.
This chronic pain we again divide into multiple. We have nociceptive, neuropathic, these are all medical terminologies. They can be the same kind of pain, shooting, burning, stinging, or any kind of continuous pain, or it will come and go also. Back pain, and we have something like piriformis, any part of the body, your muscle, there's a muscular pain. This is known as fibromyalgia. Many times it goes undetected.
Yes.
Patient feel they're unable to sleep, they're not fresh when they wake up. This continuous, we've seen in middle-aged females, fibromyalgia is the most common disease, and you do not need many things for that. We do trigger point injections or nerve blocks.
Okay.
So where trigger point injections is, there's a muscular knot or taut bands which are formed. You give injections, small injections, which will relieve the pain.
So what I understand is the pain is not necessarily a disease of some organ inside.
Yes.
The nerves, which are the electrical wires which are connecting, something goes wrong there.
Yes. There
and
any
you have
inflammation
got,
or irritation of the nerve. Even that, there's a median nerve. I would say a patient complain of pain in the hand. There's a median nerve compression, just the compression.
Okay.
We give a small injection here, it is relieved.
Right.
You don't have to go in for surgery, or medication will not relieve that.
and this pain
All
can be
this
one
is
side,
under,
both sides, sometimes
yeah.
multiple.
Now, I would like to say all this is ultrasound guided, so you know exactly where you are.
Okay,
These days, either fluoroscopic guided or ultrasound guided.
Right.
So,
And very interesting to see that even in our ancient systems of medicine, we had acupuncture and
Yes.
various types of homeopathic medication, pressure point,
Points.
reflexology.
even today, it is they do suggest all those things.
Okay.
Along with this, I've seen dry needling, something known as dry
yes,
needling. We
dry
do.
needling.
Dry needling again. You have lateral epicondylitis, tennis elbow,
Yes.
golf elbow, all that. Now golfer's elbow. So for this, what we do is dry needling of that particular place under ultrasound guidance. So you don't injure the tendon. That is the only idea of doing with ultrasound. So if that, what happens? You increase the inflammation. With inflammation, healing happens.
With the increasing interest in the sports and
Yes.
so many youngsters
Yes.
and also veterans taking to sports, I'm sure there are a lot of aches and pains which normally we think it's used to be exercise.
Exactly.
In fact, one of the gymnasiums had said that pain is nothing but weakness leaving the body, but I don't think it's correct.
Yes.
Sometimes there is a chronic inflammation changes inside muscles and bones,
Exactly.
which does require special treatment.
Yes.
Now, what are the tests that you can do to make out where is the pain?
First is basically history with examination is the primary
History
thing.
examination.
History, because the patient gives the history
Sequence.
taking exactly what has led to the pain which has been happening. Then along with that examination, once you examine, then you can rule out a lot of things.
Right.
Once you rule out, then the basic tests are like, all any inflammatory markers will be raised. Blood tests, the basic tests, CRP, ESR you look into. Then when there is a nerve involved, nerve conduction studies. Then EMG we do for the muscle involvement. Then MRI, X-rays, the basic routine tests. Right. We come to a final conclusion. This is the actual cause which is happening. Then you plan your management
So
accordingly.
you test the nerves by nerve conduction studies, muscle by electromyogram,
Yes.
and as well inside we can do MRI scans.
Yes.
to
Sometimes
locate the
cancer
disease.
pains and all, you have to be
Yes,
very
yes,
clear.
yes.
You have to, when you are planning a lumbar sympathetic block, you have celiac plexus blocks. All these palliative care blocks when you are giving, it is very good. They give excellent pain relief. It is all, and so you have to be very clear.
And now tell us about some of the modalities of treatment that you got. What are the various types of treatment that you got once you diagnose the condition?
So, but again, as usual, we start with the medications.
Medication,
First
tablets.
is tablets. Tablets is oral. You have paracetamol, then NSAIDs. There's a limited role, very limited role. You can give it for a very
painkillers.
short, for acute stage. You can give it for a week, 10 days,
Right.
and after that you have anticonvulsants.
Right.
We have gabapentin, and along with that, a lot of combinations are coming out. Tricyclic antidepressants, muscle relaxants. Then final thing is again our opioids.
Okay.
So there is.
So where simple painkillers don't work, sometimes we have supplemented by
Yes.
medicines normally used for epilepsy fits.
Yes.
There
Anticonvulsants have an excellent
anticonvulsants are very
yes.
good, and also various types of vitamins and neurons.
In
medicines.
things like trigeminal neuralgia.
Yeah.
Carbamazepine is the drug.
Carbamazepine,
Yeah,
yes,
is the drug of choice.
Yeah.
So, you know.
So this is how I think of it. Is it very satisfying? Do you remember any case where patient was in severe chronic pain and felt
Definitely.
relieved? Could you tell the audience how exactly what happened?
Yeah, the patient was unable to get up from the chair and walk. Patient, you know, they come with back pain, radiating pain, unable to move from the chair. And the intervention, when you give this injection, we do it under fluoroscopic guidance. I did a transforaminal nerve root block for that patient. And along with that, caudal epidural block with a local anesthetic and steroid was given. Patient after 2 hours went back walking. That is the, you know, that is the only thing you're working for.
satisfying.
Yes, that
And,
is the thing you work for. You know?
When a specialist sees the patient, we
exactly.
can relieve the pain. The dental treatment, we all seen how quickly
immediate
small injection,
immediate.
quick relief.
But chronic pain,
Chronic
sir,
pain
one
is
thing
we
I
took
would
care.
like to stress upon here is there is immediate relief, but along with that, you have to supplement with a lot of
Right.
things. The physiotherapy, after that exercising, the strengthening exercises, you have to follow it up with that. It does not magically get cured. There are up to 50-70% cure, we guarantee. After that, you have to, your lifestyle changes.
Okay.
They are a must. Without the lifestyle changes, there are 4 pillars in chronic pain treatment, let me tell you. The stress. First is stress. So we always advise, these as yoga and meditation are a part of your, you know, lifestyle,
very correct,
mindfulness. Along with that, you need to reduce your stress. Stress. The other one is exercise. One is stress, the other one is exercise, diet and sleep. So without these 4 things, you cannot. Diet, complete, you know, nutritional balanced diet, what we say is, where there are no inflammatory, you know, you eliminate foods which cause inflammation, like red meat, then refined carbohydrates. We suggest all these days. Along with that, low intensity exercises like swimming or, you know, walking, just walking, plain walking. Then a good quality sleep.
Okay.
Which again reduces
Yes,
stress.
sleep is a natural
So these are the 4 pillars, they say.
Yes.
For pain, lifestyle management is a must.
Right.
Along with that, we have again occupational therapy, where they are taught how to, you know, work where there is, you can reduce pain. Then cognitive behavioral therapy, how to think. Cognitive behavioral therapy is where you are taught to think to reduce how you
This
can
is the
reduce.
ultimate final points of
Exactly.
pain medicine.
Then you have
Very nice.
physiotherapy.
Lovely.
Then you have psychological counseling. So these are all the branches which add upon us. Like, you know, we are a pain specialist. Along with that, we have an orthopedician, we have a neurologist along with us. These are the clinical people. Then we have a physiotherapist, occupational therapist, then clinical
So the whole
psychologist.
team of people.
Yes.
Now, patients normally think pain means painkiller. They mean they have got so many painkillers, they keep on popping in as and when.
Yes.
What are the side effects of this painkiller medicines?
Multiple side effects we have. We have seen so many people. Our own colleague, as I was telling you the other day, she came with a creatinine of 2.5. Her kidneys were shutting down.
So
She did
kidney
not
failure
realize
is a big problem
it's
of
a very
the
big
painkillers.
problem. Yes,
Very
very
good.
big. It's one of the problems. Otherwise, also we have multiple. Because we use very limited NSAIDs. NSAIDs are advised for acute pain relief only,
Means
only
a
for 7 days.
non-steroidal anti-inflammatory
Yes, and
drugs.
non-steroidal anti-inflammatory
So
drugs.
we got steroids and non-steroid anti-inflammatory
Paracetamol
drugs.
is
Paracetamol
again
is safe
safe,
drug.
one of the safe drugs. So we use only those
Okay.
paracetamol along with the other, because chronic pain specialists don't use
Right.
this.
Now, what are the conditions where the patient should not use painkillers at all without supervision?
There are multiple conditions.
Like
sir.
stomach, duodenum or something?
Yeah, ulcers and all when patients have, but we don't treat all that.
Right.
So that is the only thing. We don't advise only.
Right.
We don't advise, to be very honest.
And patients who have got already pain, blood thinners.
Yes,
you think
platelets,
the
antiplatelets, they
antiplatelet
also-
drugs,
yes.
they should not
Not
take
take-
aspirin
yes,
and all, because
yes.
that might interfere with clotting and interfere with the thing. Right? Now, what are the alarming symptoms where there is a danger? Bill patient should not wait anymore. Our own therapy should rush to the doctor.
Rush to the-
Kindly tell the audience.
Yes. So whenever you have neck pain is there. When you start the radiating neck pain, along with that you have a motor involvement,
Okay.
sensory loss, motor involvement. The pain is so severe, the patient is having numbness. So immediately, please do not wait. Do not, when the pain increases, you know pain is there, they are on regular painkillers and they think you can wait or it will go away on its own. It does not go away on its own. Please go consult a doctor when there is sensory, motor loss, or sometimes what happens, the red flags, what we call. You never know, in cancers and all that, tumors, fracture, trauma, any other problem is there. These are the signs we don't wait.
Right. So, where if the symptoms are limited to pain, still they are okay, but when it starts involving other systems
Yes.
like muscles causing weakness or wasting,
Yes.
then it is time to seek the proper medical attention. Don't just pop in painkillers like anything else. Okay. Thank you, madam. And viewers, in case you got any doubts, do write to us, and also you can approach Dr. Meera at Apollo Hospital, Secunderabad, in case any of your patients or family members require pain specialist management. Thank you.
Thank you so
Thank you,
much, sir. Thank you.